In this UPMC Physician Journal feature, discover the latest advances in novel surgical methods for treating epilepsy and see the clinical and research efforts to develop safer and more efficient methods to treat patients with severe seizure and movement disorders.
Right now in the United States, we have approximately 1.5 million people with epilepsy. They need help. It's absolutely highly disruptive for them.
Disruptive and dangerous. It's the result of surges in electrical signals inside the brain.
Seizures completely kidnap the entire brain activity during that time. So the patients, they lose control of everything. They lose control of their vision, they lose control of their speech, they lose control of conscious.
We're going to do a right side craniotomy and tissue resections.
About 30% of patients cannot bring their seizures under control with medication. But novel surgical approaches are offering patients new hope to become seizure-free.
What you see there is called the dura. We're going to open the dura, so you're going to see the cortex, brain. And then after that, we're going to remove the areas that are causing the seizure.
Today's patient, Marcus Clay, is undergoing a temporal lobe resection to remove the portion of his brain causing his seizures. This is Marcus in the pre-op area minutes before his surgery.
It's really tough. It's hard for me to work and take care of my kids every day.
His definition of a successful surgery is pretty simple.
Get back to my normal life and take less medicine a day. I take like 17 pills a day. If I can get down to maybe 2 or 3 pills a day and get back to work, moving around.
60 to 70% of patients are seizure-free after surgery, but the temporal lobe is associated with processing language, memory, and emotion. Surgery must be incredibly precise to treat the seizures, but preserve vital cognitive functions.
10 years ago, we brought from Europe a new method that allows us to perform this investigation in a much less invasive way.
It's called stereoelectroencephalography, or SEEG. Dr. González-Martínez pioneered this preoperative method to map the functions of the temporal lobe by placing several thin electrodes into the brain.
The whole process of investigating, understanding, putting those electrodes in, most importantly, the interpretation of the signal coming from those electrodes is a highly, highly complex task. And this is something that we were very proud of.
Preoperative mapping using SEEG helped to pinpoint this area as the seizure focus in Marcus's brain.
We're able to localize a very focal area that was responsible for his seizures, but are not responsible for the language or the memory. We're going to do a very, very selective and tailored resection that will be able to preserve all the functions and give him the greatest chance to become seizure-free.
Electrodes are then used to compare the patient's brain activity before and after the resection.
We are able now to treat many patients that we were not able to treat in the past. This is a very individualized treatment, but still a lot of work has to be done. And my dream would be maybe one day we will not need to do surgery anymore for those patients. Maybe we'll be able to really treat the areas without the need of any resection at all. Really what we're talking about is quality of life, is years of quality of life. And for me, it's a great privilege to be able to work with those patients and be able to help them to stop their seizures.
Get news and free CME at upmcphysicianresources.com.